asked Raul to leave the room because we were going to recommend that you may want to take your children out of the room for this segment. So we did the same, and we asked Raul to go into his closet, and we can hear him laughing from his closet right now. We're talking about a problem that affects 1 in 4 men, and it doesn't matter how old you are. You can be 18, you can be 75. 1 out of 4 is affected by what? Dr. Goldstein is here, by the way.
Hi, Chrissy.
Hi.
Thank you for doing this.
Hey, thank you for. I love this. This is great. I mean, you know, people are very, very embarrassed to talk about this, and I'll let you say what it is.
Okay, so this is a male sexual dysfunction, actually the most common. The traditional male sexual dysfunction is erectile dysfunction that people talk about, but this is one that people don't talk about, yet it's the most common. And it's the inability to control your ejaculation once you start the act.
And we call it premature.
It's called premature or early ejaculation.
And what is the definition of that?
So it has a definition. There are 3 aspects of the definition, and it's basically lifetime. You've had it essentially all your life. You can acquire it, but it's more common to have it lifetime. From penetration to ejaculation, typically less than a minute. On all efforts, you can't really extend that time. And it causes bother and distress, but it's defined as in the male. And one of the studies we'll talk about today is interviews of women and how it affects them.
Okay, and that's, you know, I want to talk about like the risk of having this be an issue in a man's life. And it's not necessarily a physical problem, but it ends up being a relationship problem. It ends up being a self-esteem problem.
Right.
It might prevent him from pursuing a relationship. It might prevent him from being successful in a current relationship.
Yeah, it's a devastating problem, and no one talks about it. And the FDA has never approved a treatment for it.
And you're doing an actual clinical trial with the FDA,
first in human. It's so exciting.
This is kind of a big deal to do a trial with humans. I mean, this is how the process works. You have researchers, and they do all these theoretical things, and then they start, you know, testing on little worms, and then you have to get way down the line to be able to start practicing on people. And you're doing this.
Yeah, so it's San Diego Sexual Medicine.
So can people still that are watching this segment right now, we're going to get into more detail here in a second.
They can apply it. I hope they do.
Can they call you and apply? Call you, your office. Okay, we'll talk about that more in a second. Okay, so let's talk about what you're doing. And
so let's go through some basics.
Okay.
So here is a pelvis.
Okay, this is a male pelvis.
This is a male pelvis, and give me your finger.
Okay.
So this is the base. If you lift up the scrotum at the base, and there's a muscle that when one ejaculates, that muscle goes into spasm. The name of the muscle is the bulbospongiosus muscle, but it's right, if you lift up the scrotum, it's right there. And if the man sort of says, I want to stop urination, it's the same muscle that does it also.
Okay.
So during ejaculation, this muscle goes into spasm.
All right.
So we've never thought of premature or early ejaculation as a disorder of muscle spasms. There's many disorders, migraines, where you can put BOTOX in the neck. Certainly we have BOTOX for the facial lines. That's a muscle that goes into spasm.
Will it stop the man from having a spasm? Let's just say that.
Yeah. So
or will it just delay?
If you give the correct amount of BOTOX, and we're in the first in human trial is to find out what dose does nothing, what dose does control it, and one dose does too much and actually stops it.
Is this a placebo-controlled? Or
this is placebo-controlled.
Interesting.
Yeah, so we do.
So there are people who are getting shots of sugar. Or
in
something.
this muscle, it's just 1 centimeter. It's half an inch below the skin surface. It's not very deep. So.
Oh, that's what. Okay. Well, let's talk about that. I'm thinking that every guy that's watching this segment right now
cringing.
Has goosebumps. Is a little bit like this. Like what? I have to get a shot where? And it's in that muscle.
Yes. So this is the drug. It's BOTOX.
Okay.
This box has 100 units. We're starting with really, really small, 1/20th of this dose and 1/10th of this dose in that specific ejaculation muscle.
Yeah. How are you seeing it? I mean, and I know you can't give me an answer to this, but I have to ask.
Please.
What results are you seeing?
So I can't say the results, but
I knew that scientifically he cannot say that. You know, I understand.
But the point is, there are men whose 1 minutes are different at the end of the study. And I don't know if they're placebo or active drug, but it's very exciting.
Interesting.
So I just need to ask you this question so we can put this in perspective.
You're going to ask me a question?
I'm going to ask you a question. So we have done this study of volunteers who get reimbursement for their time were asked to have sexual activity.
Okay.
And they didn't have any problems.
Okay.
And the woman was given a stopwatch to actually record the time from the penetration until the final ejaculation. And if we did this among all couples,
in America or
in
around
America,
the world?
52
Americans.
states,
Okay.
what is the actual time that men engage in sexual activity in the United States?
Erica, how am
Roughly?
I supposed to answer this? Erica?
Give me a guess in minutes.
All me, okay. You know what, in all honesty, I would say around 5 minutes.
So it's a little longer than that. 7.3 minutes is the average duration. It goes from shorter to way into 15, 20 minutes, but the median time is 7.3 minutes. But think of that. These are men who can't last more than a minute. So for women, it's a real problem. Relationships end. Men are so embarrassed.
Yeah.
They're not men, and this is a genetic problem. This is
Well,
the
I
other
was just
side
gonna-
of this.
Yeah, I was going to ask you this. Not, I mean, what we were talking in the green room, and you said this is not their fault. I mean,
It's
this is
totally
something they're
not.
born with, and they shouldn't be ashamed of. That everyone should be talking about it. It should not be taboo. It should be a topic of conversation that's a non-issue. Hey, I need to go get glasses today. I got to go to Dr. Goldstein today. Kind of thing.
So this BOTOX may actually be the first drug FDA approved for the treatment of premature ejaculation, and it's a couples issue. Not only does it affect the men, but the poor women are. What
It's more
happened?
about the women. It's all about the relationship. It's all about that. I mean,
It
the
is.
guy doesn't care. I mean, it's not a real problem, you know, unless there's somebody else involved. You know, then it becomes the dynamic becomes a problem. You know, I think this is a really neat thing that you do. You know, this you just spread so much happiness in the world with all the good things that you do down at the
You're so
sexual
sweet.
health doctor.
If somebody has this problem and wants to contact us, it's 619-265-8865, and they can read about the trial on clinicaltrials.gov, which is a website
One more thing. Yeah, that's
that's run by the government.
the shot. Do the guys feel it?
So we numb the area like what the dentist does with Novocaine.
Okay.
So we numb the area.
Not a big deal.
The needle is smaller than a human hair.
You know how guys
very
are, though?
small.
They're going to be, the guys, they're going to need, like, do you sedate them? Do you, like,
No,
put them
not
under
at all.
anesthesia?
They're actually very excited.
Do they need somebody to hold their hands?
No,
you know
they
what I mean?
don't. You don't even feel it. And the
Interesting.
beauty of this trial is the drug lasts for months and months. So they don't have to take anything at the time. They don't have to think about it. They can be like normal people. It's like
interesting.
incredible.
Dr. Goldstein, thank you for being here. How fun. For more information on this, go to fox5sandiego.com and click on the Scene On button and bring the kids back into the room. I think that was okay. Raul can come out of his closet now. Erica, we're going to send it back over with you.